Welcome back in at 8:10. The latest numbers from the CDC show flu activity is picking up across the country. Health officials report a nationwide uptick in positive flu cases, and experts are warning getting together for the holidays, it could also fuel one of the toughest flu seasons in years. Joining us to talk more about this is Dr. Meredith Porter with Inova Go Health Urgent Care. Good morning to you. Thanks for being with us.
Good morning. Thank you for having me for such an important discussion this morning.
Yes, very, very important, especially as we're all getting ready to gather with our families. According to the CDC right now, flu cases, they have jumped about 8% recently. So what are we seeing in some of our local doctors' offices in the DMV right now?
Very consistent with this. It literally over the last week just shot right up. So perfect season. We have this whole storm with the holiday season, family travels, everybody out of school. And then, of course, our 2025-26 influenza season just hit us pretty strong.
Yeah, it kind of feels like the flu season is starting a little bit earlier, maybe more intense than usual. Is that what you're seeing, and what's the reason behind that?
So we expected that this was going to be the course this year. We thought that we might even see it a little bit sooner than where we are right now, but we are certainly right in the middle of things as we speak.
And I know, of course, as we're gearing up, many people getting ready to be around family, those holiday parties. What are some of the best practices that people can try to stay healthy during this time?
Oh, I love this one. So prevention is probably the best key that we want to just focus on. So it is not too late to get your flu vaccine. So go out and get that flu vaccine. It takes about 2 weeks for it to become full protection for you. Trying your best to stay away if you are sick, stay home. Make sure we're doing good hand washing, distancing if somebody is sick, wearing masks if you're out in the community and you are sick or you're around people who might be sick as well.
Yeah, good advice there. And, we talk about some of the symptoms that we're looking out for. Sometimes it's hard to tell. Is it allergies? Is it just a cold, or is it something more serious? So what are some important symptoms to watch out for? And when is it time to go see a doctor?
Yeah, great question, actually. Anybody who has the flu will often say that while it might range and you might see some mild symptoms, often it feels like you sort of are being hit by a bus. Very rapid symptoms that can come on. You might feel fever, feverish. You might have a sore throat, congestion, runny nose. You might have body aches all over and a cough, markedly fatigued, or a headache. If you have any of those symptoms, it is good to actually get early testing so that we can evaluate you whether you need to actually are eligible for a antiviral, and you need to start that within a couple of days of symptoms. So it's important to actually have early evaluation and testing if you are somebody who's a candidate for that medication.
Yeah,
we do want to keep our eyes out, though, for those complications of flu as well that would heighten the awareness that we need to get further care immediately.
Yeah, that is good information there. You touched on this briefly, the flu shot, right? You said it is not too late. Can you talk a little bit about that?
Absolutely. So this year there is on our radar, and it's out in the media quite a bit right now, a subvariant of the flu vaccine, a mutation that we have for the most common circulating strain that we're seeing in the area, which is the H3N2 subclade K version, and it is out in the community right now. We aren't sure yet what this year's flu vaccine is going to do and how it's going to be impactful for this circulating strain that we have right now. But we do know that the most important thing that anybody can do is get their flu vaccine so that they can protect themselves. It's never 100% sure that that vaccine is going to prevent you from getting the flu. But what the important thing it's going to do is hopefully prevent you from getting worse symptoms or serious complications, hospitalization, and sadly, unfortunately, it can even lead to death at times.
Yeah, and that is especially important for the kiddos and some of the older folks as well. Before we let you go, just your best piece of advice as we are all getting ready to be around family over the next couple of days and weeks.
Well, number one, just enjoy yourself. Spend that time with your loved ones and stay well. Trying your best to really enjoy the time that you have together. If you do get sick, come in for timely testing and symptom management and treatment. And truly hope that everyone has a wonderful holiday season and that 2026 is a safe and healthy year.
All right, Dr. Meredith Porter, thank you so much for your time and your insight. We appreciate you.